What is the one thing that every single doctor should be talking about, but very few pediatricians and family medical doctors know hardly anything about? Well, that's the vagus nerve and how vagus nerve dysfunction and disorders are serious contributors to all sorts of neurological challenges in kids today. Now, the thing is, the science is clear, and there is more research out coming every year that links the vagus nerve disorders, and dysfunction to pretty much all common neurological disorders in kids, such as autism, ADHD, anxiety, and that's just the A's, sensory processing disorder, SPD, and especially seizures and epilepsy. So, if you're a parent and you have been searching for answers to help explain your child's neurological conditions, and you haven't yet gotten a full understanding of what's really going on from their pediatrician, from their neurologist, or the other traditional care providers that you have sought care from, and if you've done all sorts of research and you've looked into the role of gut health and neurological disorders, you know about the gut brain connection and the brain gut connection and the vagus nerve already, but you want to learn more. This is for you guys. This is why I'm doing this for you. Today we're going to talk about the vagus nerve and how vagus nerve disorders link from everything from, like I said, autism, anxiety, sensory challenges, and ADHD to seizures and dysautonomia, POTS, pandas, and more. Lions, tigers, and bears. Oh my. You know, the wildest thing to look back through many of the cases that I've managed over the last decade, the wild ones are seizure cases. Not wild because seizures are wild. Like seizures are a terrifying, scary thing. But what's wild is the way that those types of kids that are dealing with those situations change. And to see the improvement going from having, in some cases, multiple seizures, not only per day, not only per hour, but multiple seizures in a 10-minute window, to having long bouts of being seizure free and being able to get on with their lives and do the things that kids should be doing and not being in constant fear of when's it going to happen next. Those are truly the most life-changing cases. They do a lot for the kiddos we take care of. And also they bring us a ton of joy to help get that kid back into being a kid. Now, if there was one thing I say that I wish I could teach all parents, just a blanket thing of knowledge, that's going to be the connection between birth intervention, birth trauma, early exposure to toxins in kids, and what we call vagus nerve disorders or vagus nerve dysfunction. There is a definite correlation there. The vagus nerve is by far and away the single most important nerve in your entire body. I'm going to say it. Like, it trumps the sciatic nerve because all that thing does give us sciatica. And, that's worthless, right? Kidding. The sciatic nerve does a lot more than just hurt. But the vagus nerve, it's a pretty important one. It serves to control and regulate core developmental health. It helps to serve and regulate function in kids in things like sleeping, eating, digestion, immune function, speech, communication, socialization, behavior, and emotional regulation. Not just the eat, sleep, poop button. It does those things really, really good, but it does a lot of other things too. And the thing is, when this one thing goes wrong, the vagus nerve is not working right, then it's going to open the door for a myriad of perfect storm, or we just call neurological challenges to happen. Now, vagus nerve disorders and vagus nerve dysfunction is strongly linked to common neurological challenges in kids like autism, ADHD, sensory processing disorder, SPD, anxiety, epilepsy, seizures. Like I've said, this is the third time now, as well as two other conditions that are dramatically on the rise in teenagers, especially, and that's POTS, POTS, and PANDAS, PANDAS. They're both acronyms. POTS being postural tachycardial syndrome, and PANDAS, pediatric autoimmune neuropsychiatric disorders after strep. See why I just use the acronyms? A little bit easier. Okay, Mr. Chiropractor Man, you are asking, and I would correct you and say, actually, it's Dr. Neurologically Focused Pediatric Chiropractic Man. But, whatever, it's just semantics, right? How is vagus nerve disorder and dysfunction linked to all this other stuff? I'm going to tell you. First, the vagus nerve is often injured or damaged via birth interventions. Now, this is things like trauma from forceps, vacuum extraction, induction, or C-section. Second, the vagus nerve is very, very sensitive to early exposure to toxins. Now, this is going to be things like antibiotics and overuse of other medications. It's an important link here. Vagus nerve disorders and the dysfunction, known as subluxation, first show up as things like colic, constipation, ear infections in infants. And parents are mistakenly told, here it is, and I hear it all the time, don't worry, they'll grow out of it. This is normal. It is something to worry about. They will not grow out of it, and no, it's not normal. Then from there, they're going to progress into neurodevelopmental delays, motor challenges, and things like missed milestones. These often show up as delays in walking or talking, frequent tantrums or meltdowns, and these meltdowns can be just huge, just massive. But we're also going to see other emotional and behavioral problems in toddlers and preschool age children. And then finally, there we are. Vagus nerve is not working properly to calm, balance, and regulate that side of the nervous system. Remember that parasympathetic, rest, relax, regulate side of the system. And grade school kids and teenagers are going to end up in this sympathetic, fight or flight, go, 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 gas pedal down, nervous system stuck on, constant overdrive in the fight or flight, which is going to contribute to a ton of different challenges like hyperactivity, impulsiveness, paying attention problems with behavior, having anxiety, and the list goes on. For many, many kids, if that vagus nerve disorder and the dysfunction is there for long enough and it's severe enough, that can even contribute to very challenging conditions, such as building up over time, seizures and epilepsy, POTS and PANDAS. All of this, all these conditions are deeply rooted in neurological dysfunction. Now, they are very much needing neurologically focused pediatric chiropractic care like we provide here. And the thing is, I'm not just blowing a bunch of smoke. These are all things that I have seen kids with, and these are diagnoses. They do not define the child. They just really describe a bunch of symptoms that the kid is experiencing, and we see improvement. And that is the coolest thing ever. So, thankfully, the vagus nerve function can be measured, and that is something that we address in the office. And we can look at it through a couple of the different measures that our Insight scanning system allows us to. In a 3-minute scan of heart rate variability, we can really get down and see what that balance between that sympathetic stress stuck on and the parasympathetic vagus nerve rest, relax, regulate systems are doing, and get a good understanding of how your child's doing underneath the hood to see what's going on. Once we have all this information, we can put together a very customized, specific, personalized care plan to your kid. It's not throwing anything at a wall and seeing what sticks. It's going through a detailed history to understand, first, how was the pregnancy with this little one? How was the delivery? What type of birth trauma have we seen? Have we hit all of our milestones in what order? Or were some of them delayed? And what are the other challenges we're seeing? When we put all those things together into our algorithm, we get customized care for an individual. And that is amazing. And we get great results without the use of drugs or surgery. So if you can jive with this, if this is making sense, if this is something that you need in your life, shoot me a DM, send me a message, give me a call. I'm here to help your kiddos. I'm here to help your family. If you know somebody who's going through a similar situation, please share this. We've got more information about the vagus nerve in our previous blog posts and our special blog post this week. So I'll talk to you soon. I can't wait to see you. Take care.